Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Adenocarcinomas of the esophago-gastric junction. So we are looking at the C word. So in terms of type 1, it is where the tumor is centrally located between 5 and 1 centimeter. So it is between the 5 and 1 centimeters, proximal to the anatomical cardia. So it is proximal to the anatomical cardia. So what is the surgical approach here? It is the approach is as esophageal or the EGJ cancer. It is approached as esophageal as well as the EGJ cancer. Next is the type 2 variety. The type 2 is a tumor located between 1 centimeter. It is 1 centimeter proximal and 2 centimeters distal. 2 centimeters it is distal, and this is to the anatomical cardia. So the surgical approach is, it is approached as esophageal or the EGJ cancer. Lastly, we look at the type 3. So under type 3, the tumor is center located between 2 and 5 centimeters. So it is between the 2 centimeters and the 5 centimeters, distal to the anatomical cardia. So this is distal to the anatomical cardia, and this will be approached as the gastric cancer. To learn and grow daily like this, please do subscribe.